I'm a first-generation immigrant who came from India. Across from our school was a juggi, which is an Indian word for a slum. My mom, who was a school teacher, would take me every week. We started bringing books and then started bringing toys. And then I found myself next to the nursing stations. And I just realized that someone's health is way more than just medical care. We really wanted to unify how someone navigated both a healthcare system and the welfare system. When you have to figure out where I'm gonna sleep tonight, what I'm gonna eat tonight, you have a missed appointment, this turns into an emergency room visit. This turns into an unmanaged chronic condition. Who ultimately pays the price is not just the individual, but also our healthcare system, Medicaid, the largest public insurer in the country. So we set out at Pear to unify these two systems so that we can make it easy for people to navigate both the healthcare system and the welfare system.
We partner with Medicaid plans. We work with their highest need beneficiaries, people experiencing homelessness, severe mental illness, substance use disorder. We work with kids in the child welfare system, seniors at risk of institutionalization, people transitioning from incarceration, to identify what are their social needs, their behavioral health needs, and their medical needs.
Very quickly, we realized we need to build our own medical group. Doctors, NPs, registered nurses, licensed clinical social workers, and then community health workers on the ground.
We have really deep partnerships with organizations in the community, and they have the trust of the people in the community.
Mercy Housing and Pear Team together, in our partnership, we are able to provide support to residents in a multitude of ways. It starts with the initial touch, that engagement piece with residents, and then making the determination of eligibility.
Our team will then do an outreach and do a really personalized intake to understand their immediate health needs and their patient goals. From then, they're paired with one of our community health workers, a lead care manager. That lead care manager has a dedicated personal relationship.
These are all folks who their entire world is working with patients. They're really the connective layer between a very complex healthcare system and social benefits and how the patient can actually access those things.
I think that there are many, many challenges with trying to figure out what the modern medical system is. And you can imagine trying to navigate that if you're an older individual that may not be technologically savvy. It can be very overwhelming and intimidating.
Well, I found my way through Pear Team, my love with case management. I wanted to work with the people that needed the help. My mom was a diabetic, and she had hypertension. She had all the concerns that we deal with on a regular basis, but she had no support. I want to help that lady that's homeless like my mom was. I want to help that gentleman suffering from addiction that feels lonely like my mom did. And that's what Pear Team means to me. I guarantee you every lead care manager feels the exact same way.
At Pear Team, we're uniquely positioned to build the most effective AI-first care ecosystem.
What if every person that we serve in the safety net has a digital personal assistant that understands their health and social needs and can navigate them through the system? We could stabilize people much earlier and put them back on an upward life trajectory.
When you use AI to extend the reach of your care team, you can suddenly take this model of care that we've been building out for a really high needs population. We can now offer that to everyone in the safety net. And that's what really excites me. At Pear Team, we're building whole care for whole lives.